composite restorations, a couple of Invisalign cases, and then a few crown deliveries. Tell the people what you're doing.
We are filling a triple tray to take an impression.
Done today. One filling, three, sir.
Okay. If you want to become a dentist, and that is your goal, you will get there.
5:20, 5:30 p.m. So that was a pretty normal day. Hi friends, so today I want to take you through a day in my life as a dental assistant, show you some of the procedures that we get to do in a busy general dentistry practice, and tell you guys why it's a good idea to work as a dental assistant before you start dental school. So first thing we do when we start out the day is we do a kind of like a walk through the office. We open up all the operatories, bring the chairs into working position, turn on the x-ray units, and make sure that all the rooms are stocked for everything that we need. As you guys can see, the day has already started a couple hours ago, so everyone is quite busy and getting to work. Okay, we've got two dentists and one hygienist, so 3 providers. So there are a few assistants on schedule to work as well. So as you can see here, I'm taking you through kind of like a tour of the office. So upstairs, we've got 9 operatories. And then downstairs, we've also got 4 more where we usually have pediatrics some days a week. Also love the artwork. One of our dentist's wife is actually a professional photographer. So this is all of her beautiful artwork that was curated by one of our other dentists, which is really cool. Dasha, tell the people what you're doing.
We are filling a triple tray to take an impression for crown. So you can come follow me.
So one of the most frequent things that we get to do or have to do as assistants is taking radiographs or x-rays. So in our office, for all of the recall patients that come in for their regular 6-month cleanings, we do checkup x-rays, which include 4 bite wings and 3 PAs of the anterior teeth. So in our office, the assistants take the x-rays as well as bringing the patient into the rooms. Some offices have the hygienist do the whole thing, but for us, we get to take the x-rays. And the cool thing is that this is something that you're going to have to learn to perfect in dental school. So being able to work as an assistant and get tons and tons of practice taking radiographs or x-rays, whichever way you prefer to call them, is really great practice. And, you know, I've had to learn how to do it relatively quickly and also how to accommodate because sometimes patients have a hard time biting down on the sensors or their mouth is just very small. So you have to try to find either a smaller pediatric size sensor or just figure out a way to place it in a certain way to accommodate the patient to give them as little discomfort as possible. You also want to try to be really quick in and out of the room when you're taking the x-rays because you don't want them to be biting down on it for too long, especially with the bite wings, because it can press on your gums. It could also trigger a gag reflex in some patients. So I've had to learn how to kind of, you know, run in and out of the room and be very quick about taking the x-rays. I think one time I even managed to take an entire set of x-rays in about 30 seconds. Thankfully, the patient was extremely compliant and she also had a decent amount of room. So I was able to easily place the sensor without giving her any discomfort. So it went by really quickly. Okay, so here we have doing a composite filling. Let's see what everybody else is doing. How's the impression?
Impression is going well.
Nice.
3 more minutes.
Nice. So we've got a recall patient. This is our hygienist, Olga. Say hello. So here I am setting up for a composite restoration. So in our office, in order to kind of expedite things, we created trays for different kinds of procedures. So we have trays for composite, we have trays for root canal treatments, so that everything that you're going to need for the procedure is readily accessible. Unless it's, you know, something that is an instrument that needs to be sterilized, everything is pretty much on the tray. So for us, that would mean a few different shades of composite that is packable, a few different shades of flowable composite, as well as bonding agent, the little micro brushes, the pogo polishers, and a few other things. So before the procedure, we also set up all of the instruments for the dentist before calling them into the room. So I just unpacked the basic, put on the air water syringe, And now I'm setting up the anesthesia. So we always use a topical anesthetic before injection, and then we load the syringe. Typically, we start with lidocaine. If a patient indicates that they can't have the adrenaline, we'll use a different type of anesthetic, or if it's a surgical procedure, we'll also use a different kind of anesthetic depending on the situation, but most frequently we do use lidocaine. I also grab a few cotton rolls. Our dentists like to use them to kind of retract the cheek and provide sort of a barrier for saliva. I also grabbed a plugger because this is a posterior composite restoration, so that instrument is a must. We also sometimes have a plastic on hand, but it's not always used for posterior composites, so we just keep it there just in case. And I also grabbed the Scotch Bond bonding agent and a little micro brush. So our dentists also like for us to lay out all the burrs that they're going to need for the procedure. So typically for them, that will be the 556 burr in order to drill out the cavity, as well as 2 white stone burrs that are used to polish and adjust occlusion. Sometimes they will also use what's called a flame burr. That is a skinny tapered one that is usually used to polish in between. And then I will load the composite gun. So since I've already seen the patient's teeth, I can kind of gauge the color of the composite. Sometimes the dentist will specify. But here I just selected the shade that I think matches the most. And then since this cavity is in the interproximal space between the teeth, we use a Tafelmeyer matrix. So we use a matrix band, and then the instrument that holds it is called the Tafelmeyer. So you place the matrix band and then you adjust it, and then the dentist will alter the size based on the size of the tooth and to make it fit. So here I am with Dr. Dragonchuk. She just placed the topical anesthetic in the injection site, and the purpose for the topical anesthetic, which is kind of like a flavored jelly, is to numb the area where the needle is going to be inserted, to make it so that you don't feel the injection as much when it's first going in, because once it goes in and the anesthetic starts being injected, you kind of start to feel numb in that area. However, that first pinch is still felt, and so that's where the topical anesthetic kind of comes in and makes your gum a little bit more numb, so that you're not as sensitive to the injection site. So after the anesthetic is injected, we take a few minutes, we let the patient get numb, and then we make sure that we have everything set up for the procedure that we need. The doctor will also review the radiograph to make sure that we understand the full scope and size of the caries, and just confirm the site of the fillings that we're doing. And what I love about our office is that all of our dentists really take the time, especially if you're a pre-dental, to kind of explain things to you and show you what goes into their diagnosis. So in my time here, I learned about all the surfaces of the teeth. I learned how to take a look at x-rays. Obviously, it's not as extensive as dental radiology classes, but I definitely learned a lot about how to spot and identify caries on x-rays and how they use them in terms of treatment planning. Then we discuss, situations where sometimes we see incipient caries, so sometimes those things are very small cavities where they haven't even penetrated fully through the enamel. So those are things that we may watch rather than just immediately fill. So all things that are really interesting for me as a pre-dental student, which is one of the main reasons why I love working at an office like ours. So here we are getting started. So this particular patient was very apprehensive, and she was telling us how she's had a few horrible experiences in the past. And so she actually put on, noise canceling headphones, and she was saying, if you need me to open or if you need me to do something, just tap me on the shoulder because I just need to tune everything out, which is completely understandable. And actually, if you have a little bit of dental anxiety and you're one of those people who just gets really, really anxious and frightened in the dental chair, a lot of it does have to do with all those scary drilling sounds. To kind of help avoid that and avoid sensory overload, a lot of patients do choose to wear headphones, which is really helpful. As long as you're able to hear us and we can effectively communicate with you during the procedure, you can very much tune out, listen to your music, or watch whatever we have on TV for you to help you be distracted as much as possible so that you're not fully focused on what's going on.
There you go. Wow.
So after every procedure, we will take all of the instruments and bring them to our sterilization area. Most of the instruments will go into our ultrasonic to be sterilized before they go into bags and then get sterilized in the autoclave, so that they go through 2 stages of cleaning, sometimes even 3 stages of cleaning. The larger instruments will go into the large ultrasonic, and then the smaller instruments like the burrs and the Tafelmeyers will go into a separate container. And then obviously everything else that is single use gets thrown out, and the trays get wiped wipe down with a antibacterial, antiseptic, really aggressive cleaner that you really don't want to get on your skin, but it's really good at killing pretty much every single germ that anybody can have. We make sure that it's all really clean, and then anything that we will use again gets also wiped down to make sure that there's no bodily fluids or residue left anywhere. Okay, so it's currently around 3 p.m. So far, very straightforward day. We haven't really done anything too crazy, mostly composite restorations, a couple of Invisalign cases, and then a few crown deliveries. I'm going to try to show you guys a few more different procedures that we're going to do. I think we have a crown delivery coming up and then a crown prep as well. I was trying to catch a root canal, but I didn't get to assist on it because there's a few assistants, and then whoever's free takes the next patient, so wasn't able to catch that. But there are a few other things that I could show you. But yeah, this is basically a standard Monday. We have 3 providers, so 2 dentists and then 1 hygienist working today. Normally that's the flow of our office. The office is open today from 9 to 7. I came in from about 11 and I'm gonna stay until around 5. But yeah, this is the standard working day. So one of the other things that I really love to do in our office is that we have a couple of doctors that do Invisalign cases. So what we do for consult, as well as just to keep a record for most of our patients, is we do the Itero scans. And Itero scans basically have this machine where it takes a bunch of photos per second and creates a 3D model of a patient's teeth. And for a lot of patients, it's really helpful in terms of being able to explain what we're seeing in their mouth, because being able to see it from different angles and not being restricted by the lips or the gums or the facial anatomy, and just being able to focus on the teeth really help in terms of explaining treatment plans, as well as discussing treatment options, whether one of those options is Invisalign in terms of straightening out teeth, closing out gaps, or getting rid of crowding, or any other issues that patients may have, including overbites, underbites, clenching, all of that. So here I am performing the Itero scan on a patient, and you can see that I kind of just noticed that I'm blocking the view of the Itero, and I actually wanted to show you guys what it looks like because it's pretty cool and it's pretty interesting how it creates this model. So here I'm just moving over so that I can give you guys a better view, but it basically just takes a bunch of pictures and just creates a model of your teeth that way. For most people, the scan takes anywhere from about 2 minutes to 10 minutes, depending on the person's teeth and also depending on how experienced the person who's scanning you is. But for me, my actually fastest time, we've got like a little bet going on in our office on who can scan the fastest. My fastest time so far has been 1 minute and 53 seconds for the full mouth scan as well as a bite. But I'm trying to get that down because one particular coworker is really competing with me and pushing me to try even harder and get an even faster time. So that's been fun to do. Okay, so this is Dr. Gelfand. You didn't see him working today, but he is one of the owners of the practice that I work at. He's actually been my dentist since I was 10. So I have a few questions for you. First is, what made you decide to become a dentist? For all the people out there, to inspire them.
I always wanted to do something with medicine, but I knew I did not want to go to medical school. My father is very handy, and he was always taking me with him to watch what he does. And I wanted to do something with my hands.
Okay.
And dentistry was the perfect thing.
Okay, so one more time. What's one piece of advice you would give to someone who is aspiring to become a dentist?
Is to have a goal in mind. If you want to become a dentist, and that is your goal, you will get there. That's the main thing in life, to look forward to something in the future, and you'll get there.
There you go. If you want to see more of us working and having fun with dentistry, please stay tuned and subscribe, and we'll see you soon. Okay, so I just got out of work. It's about 5:30 p.m. So that was a pretty normal day. It was actually a bit slower than I'm used to. Usually Mondays are a little bit more hectic. Today was actually pretty good. Nothing too crazy, nothing too busy. So today we had 2 of our dentists working. We had Dr. Gelfand. He does more of the Invisalign cases and more aesthetic stuff. And our associate Dr. Dragonchuk, who does more of the restorative procedures. So that's the 2 doctors that you saw working today. We do have a couple of other dentists working in the practice. There's definitely a lot more to see. So if you guys want to see a part 2 to this video, where I talk about or show you some of the procedures that we do, like the surgical procedures such as implants, bone grafts, sinus lifts, and then let you see more of the restorative stuff like crown preps or root canals, let me know. I'll do a part 2 and introduce you to some more of the doctors that I work with. But that was pretty much it. That was a pretty standard day. It's a little bit shorter than normal. I usually come in from around 9 to 7. Today I came in a little bit later, left a little bit earlier, so a shorter day than normal. I also hope you guys enjoyed those pearls of wisdom from Dr. Gelfin. He's actually one of my mentors, and he's been my dentist since I was 10 years old, but he was also one of the many people who had inspired me to go into dentistry and who has taught me a lot, pretty much everything that I know. And he's a tough boss, but he actually forced me to learn a lot of the things that I learned on the job, so that was pretty awesome. So yeah, stay tuned for more videos. Thank you for watching. Thank you for sticking around. And if you have any questions, feel free to drop them in the comments. I will also link our office in the description if you guys need a dentist. You're in South Brooklyn. We've got 2 locations. We've got great dentists, and we have a lot of fun. So I will see you guys next time. Thanks for watching.